Piyush Aggarwal from the Postgraduate Institute of Medical Education and Research, India, and my poster is on preliminary results of 177 lutetium PSMA 617 priming with enzalutamide in metastatic castration-resistant prostate cancer, which was a single-arm phase 2 trial named as LU-PRIME. So novel anti-androgen therapy like enzalutamide, it is an integral part in treating metastatic castration-resistant prostate cancer patients. And recent preclinical and clinical studies have shown that enzalutamide increases the PSMA expression of prostate cancer cells and may enhance the therapeutic efficacy of lutetium PSMA 617. So we aim to evaluate this effect of enzalutamide priming on lutetium PSMA therapy outcomes in metastatic castration-resistant prostate cancer patients. So, histologically proven mCRPC patients with prior history of receiving at least one taxane, either with or without androgen receptor pathway inhibitors, and who were referred for lutetium PSMA 6-1 therapy, were prospectively recruited, and a short course of enzalutamide, that is 160 milligram per day, 1 week before and after the scheduled radioligand therapy, was administered. And those patients who were already on enzalutamide, they discontinued it for 4 weeks so as to achieve adequate plasma clearance before restarting it according to the trial priming regimen. And lutetium PSMA 617 was administered IV around 7.4 gigabecquerel per cycle at 6 to 8 weekly intervals, and up to a maximum of 4 cycles were given. The primary endpoint of this study was the best PSA response rate, and the secondary endpoints were the objective response rate, treatment emergent adverse events, which were assessed using CTCA version 5, the progression-free survival, and the overall survival. So 20 mCRPC patients with a median age of 67 years, they received a total of 50 cycles of lutetium PSMA 617, and they received a median cumulative activity of 15.5 gigabecquerel along with enzalutamide priming. PSA 50 response was achieved in 50% of the patients, and based on RECIST 1.1 criteria evaluation in 18 patients, the objective response rate was 28% and the disease control rate was 39%. So grade 1 and 2 treatment emergent adverse events were observed in all the patients, with fatigue being most common and anemia being the most common hematological adverse events. Grade 3 adverse events were observed only in 4 patients. And these patients have been followed up over a period of 15.6 months, and they have had 15 events of PSA progression, 15 events of radiological progression, and 10 deaths till now. The median PSA PFS was 4.3 months, the median radiological progression-free survival was 4.6 months, and the median overall survival was 15.2 months. So concluding, short course enzalutamide priming did not significantly improve the disease outcome in metastatic castration-resistant prostate cancer patients who were treated with 177 lutetium PSMA 617 compared to the historical data. However, the final outcome is still awaited in this ongoing study, and multicentric randomized control studies are required for the validation of these results.